that they need a blood specimen that is called a blood draw or a venipuncture. Normally, the patient doesn't think anything else about this until the nurse or medical assistant walks into the room with several tubes. But you shouldn't worry about that when you see that, because every person is encouraged to bring in 2 tubes for every blood draw that they need. So once the provider tells the nurse or medical assistant that they need an order, this is called either a verbal order or a written order. And that is because medical personnel is not allowed to do anything without one of these 2 orders. In the lab, the nurse or medical assistant will go in and start filling out the lab requisition. They will then sign it when it is completed and bring it to the provider. The provider looks over it, and if they agree with it, they sign it. This ensures that all the information on the lab requisition is correct. They will return to the lab and start collecting all the supplies. They go into the patient's room at that point, and they start checking for first they check 2 patient identifiers. This ensures that it's the right patient that they're going to pull the blood from, and then they start looking for an acceptable vein, which can take 1 to 2 minutes. And you don't do any of this based on the visualization of the vein. You more are going to feel for it by feeling the size and the bounciness, if you will, of the vein. Once they have found an acceptable vein, they will apply their gloves and take an alcohol prep pad and clean the area thoroughly. This ensures that all the body oils are removed from the skin, the germs, bacteria, any other contaminants, dirt, that's all removed. They will open the package with the butterfly, straight needle, or syringe and apply the hub if they choose to use one. They're going to then apply the tourniquet and start drawing the blood in the correct order. Once they are finished with the blood draw, they're going to remove the tourniquet, and they're going to remove the last tube from the hub if they chose to use one. And then they're going to place a cotton ball or a gauze gently over the site of penetration where the needle enters the skin. They will pull that out and put more pressure on the cotton ball. Then they will immediately dispose of the needle that was used, and if the patient would like a Band-Aid, they will put it on then. They're going to invert the label and invert the tubes, and this allows the tubes to be mixed with the clot additive or any other additive in the tubes. They are going to return to the lab and place any tubes that need to clot into a test tube holder. Everything else will be placed in a biohazard bag and in the refrigerator. Once any of the clotted materials have clotted, they are placed in the centrifuge and spun down. Then they will pull them out of the centrifuge, and if it's an SST tube, they will just simply remove the top and pour it into a transport tube. If it is any other tube that needs to be separated, they will use a pipette to pull the serum off of the clot. The only thing is you have to be very careful not to disturb the clot, and this will make the lab inaccurate. At this point, the lab will either come and pick up the processed blood draws, or they will be sent to the lab at that time. An interesting fact that I ran across while I was doing this is that the National Center for Competency Testing states that any adult has approximately 5 liters of blood running through their body at any given time. That's almost 1.5 gallons of blood running through your heart, your veins, your arteries, capillaries, and all your other vessels. So who sets up these standards? That's a very good question, and it is the Clinical Laboratory Standards Institute, and their website states they have over 1,800 volunteers. They have 12 different areas of standards guidelines, and they have 9 different committees for standard development. They dole out more than 75,000 standards and guidelines per year worldwide. So the standards are only changed if the facility can prove that there is an interference or inaccuracy in the way that in the method of blood collection. This most healthcare facilities should use the most up-to-date recommendations. The Mayo Clinic is one of these that has changed this because they have shown that when they were pulling labs for trace elements and lead, if any of the tubes before were pulling the trace minerals out on the back end of the needle. Only the tan and navy blue do not have these trace elements in their stoppers, and so they use those and they pull them first. Now we're going to get to the fun part now that I've gone from the beginning to the end of the entire collection process. BD Vacutainer is one of the largest manufacturers and distributors of medical supplies in the nation. They supply charts like this to virtually every healthcare facility. Um, this sheet can be very helpful when answering many questions, and one of which is how many times to invert the tubes, which is on here. And most of them are 8 to 10 times. I will only note the ones that are inverted less than that. So the first thing you're going to pull is anything that is a sterile collection. Next, you're going to pull your sodium citrate tubes, and those are the light blue tops. They're inverted 3 to 4 times. Then you're going to pull your serum separator tubes or SST tubes, and these are the most commonly used, and they are only inverted 5 times. You'll then go to your red top tubes, which are your serum tubes, and if you're using a plastic tube, you're going to invert it 5 times. If it is the glass tube, it will not be inverted at all. Next, you're going to go to your RST or your rapid serum tube. It's an orange top and inverted 5 to 6 tops. And then the plasma serum tube, it's light green or very light blue. Then you're going to go to your heparin tube. It's a dark green, and then your EDTA tubes, which are either the lavender light purple or the pink tubes. The next is the plasma preparation tube. It's a pearl or white top. And then finally your fluoride gray top tube. So to sum everything all up, unless you work in the medical profession, you don't realize how much actually goes into a blood draw. Medical personnel have this basically down to a science, and they can have pretty much all of this done in 10 minutes. There is a little and sometimes true joke that says to be nice to your nurses and medical assistants because sometimes they can keep your doctor from killing you.